So, welcome to this session. This is an NHS England and NHS Improvement monthly community event hosted by the People Directorate. And we've been having these events to support the health and wellbeing of our NHS-19 response. Every month we have a different topic, and today's topic is all about improving cultures through a focus on civility and respect. And civility and respect is all about how we treat each other and how we treat each other at work. So welcome to this session. These are our aims. So we're going to be offering support, ideas, knowledge and wisdom to those in a role supporting the health and wellbeing of our staff. We're going to be sharing a range of wellbeing support activities that are available, and we hope that you can connect through the chat box in both Zoom and YouTube. We've now hit our 1-year anniversary. So if you have been joining these sessions for a year, thank you for being on this journey with us. This is our 23rd session, and I just thought I'd share with you some of the figures. So we've had 23 sessions to date. We've had 23,000 views of these live sessions and the recordings. And we also provide all of the slide decks as well, and we've had over 110,000 views of those as well. So the recordings and all of the slide decks can be found on the Horizons website. So if you are looking for any other topics, whether that's working with children at home, whether that's anything to do with recovery, or we've had 23 different topics, please head to the Horizons website and have a little look at those slide decks and recordings as well. So this is our agenda for today, when we're going to be focusing on civility and respect. My colleague Zara is going to be joining me and co-facilitating today. Unfortunately, Elizabeth Nawadi couldn't join us, but she'll be back next month. We've got Alan Nobbs giving us a Project M update, which is all about our middle managers and our leaders and providing support for them. We've got Radhika, who is our civility and respect lead in NHS England and Improvement, is going to be giving us the national overview and an overview of the Civility and Respect programme. And there's a toolkit in there as well that Radhika is going to share. Delighted to be joined by Professor Duncan Lewis, who's been doing loads of research into the effective organisational solutions for tackling bullying, harassment, incivility and disrespect. So lots of practical tools and top tips for you there. We've also got Dr. Chris Turner with us. Chris is a clinician, and he has also co-founded Civility Saves Lives. So lots of top tips there. And you will be finishing the session with both myself and Zara.
And our team today is, as Zoe has mentioned, me and Zoe, who you've heard from already. We've got Alan Nobbs, Radhika Nair, Professor Duncan Lewis, Dr. Chris Turner. And behind the scenes, we've got our technical host, Paul Woodley. So please do message if you can't hear or you can't see the screen. We've got our chat box facilitators, Louise Pramas and Karen Domain, our YouTube host, Ian, who's on YouTube with us. So please do comment there as well. And social media, we've got Lee Kendall tweeting. So please do use the hashtags, hashtag caring for NHS people and hashtag Project M. First off, we've got Alan Nobbs, who's the head of design and development in NHS Leadership Academy. So over to Alan.
Hi, thanks, Zara. Good evening, everybody. Delighted to be joining you once again on the event this evening. Just a really quick update from me about Project M, and to all those of you who are returning to the wellbeing space this evening, apologies just briefly to cover off some things for those of you who may be new to our space. So. Hashtag Project M is really just the label behind an idea that was to build community, particularly for team leaders and line managers in the middle of organisations, to say, what together can we learn about our issues, our challenges, our opportunities? What do we already know? What can we actually find in terms of our ability and skill to do the leadership work that's particularly needed of us today, and how can we support each other and nurture each other to grow and develop? Really, there's 4 prongs to this community's work. We have a virtual community, primarily fed through Twitter, but also on LinkedIn and Facebook increasingly. We have some online resources which are available at the people.nhs.uk website.
Alan.
Hello.
Hello. Sorry, there's a few little comments in the chat box to say that your audio is not too good. Could you just move a little bit closer to your mic? That would be super. Thank you.
I will indeed. Apologies. I hope that's better. I'm not sure whether it is or not, but please keep letting us know. So, 4 prongs to the community. A virtual community fed through Twitter, but also on LinkedIn and Facebook. We have some online resources via people.nhs.uk/project N. We're building social collaboration through peer support groups, and we're encouraging people to engage freely in seeking out or offering peer support mentoring to each other during these particularly challenging leadership times. If you could move forward for me, that would be perfect. Slide, please. So, in the spirit of numbers, we started the Project M community discussions sort of in December, and since then, our people.nhs.uk Project M website has been accessed by over 11,000 people, the majority of whom are our team leaders, our leadership line managers in the middle of organisations. And together, they've accessed various resources over 21,500 times. So a really vibrant community. But it's one that we're trying to keep alive. And one really powerful part of that community is the resources that are available on our platform at people.nhs.uk. And so the site is currently undergoing an exciting refresh. There's a snippet of a picture there of what the new site looks like. We're hoping to make it more accessible, more readily available, and put in priority the things that the community tell us are most important. So we know people love short, sharp inspirations. What can I learn from, get engaged by, whilst I'm doing the other things in my life, cooking dinner, cooking lunch, going for my walk? How do I go about finding a mentor? How do I get involved in peer groups? So we're really looking to think about how we constantly keep the community alive. So the site is being refreshed, its content is also constantly revitalized. And we're reaching out beyond the world of Twitter and our existing community. Lots of work already now being done with additional promotional materials and connections across some communities that many of us find very difficult to get access into, but are nevertheless really important communities and deserve our attention, deserve to be part of this community. So a lot of work going on to keep this community very vibrant. Next slide, please. One particularly important part of the community is our offer around mentoring. And we've encouraged people to signal to the world, particularly through social media, that I'm up for mentoring somebody, providing a space to help them make sense of their world, keep themselves well, by wearing the Project Mentor Twitter. Equally, we're encouraging people to find the courage to say, I quite like a mentor. I'm wrestling with a few issues and challenges, and signaling to the world they're there for a conversation by putting a little Twibbon badge on their Twitter profile, mentor me, Project M. Not a big community right now in terms of the Twibbon wearers, 114 people wearing the Twibbon to be a mentor, 97 people visibly wearing that. But we know from activity on Twitter, LinkedIn, and Facebook that people are just taking to this and they're meeting up despite the Twibbons. They're having powerful conversations and they're finding them incredibly supportive. Primarily, what we hear from our feedback is that just the creation of the place and the space for us to gather, to say what we need to say, to be heard by others who will listen with fascination and without judgment, and to realise that we have many of the resources that we need within us and between us is incredibly powerful in its own right. And so a lot of our activity around our tweet chats, our talk and chats, and our listens and learns are a vital part of the fabric of this community. But there's a big gap coming up in May. We can't run our regular monthly tweet chats. We're going into that period where we have to be very careful about what we communicate and how we communicate as we go into local elections. But we're still going to be connecting. So look out for our upcoming afternoon tea and talk opportunities. These slides will be shared. Look out for our upcoming listen and learn sessions, many more opportunities through April, May and June. And the tweet chats are going, we're just pausing for a month. Tweet chat with Project will be back on Tuesday the 1st of June 2021. And meantime, don't forget the next Health and Wellbeing webinar, which is about a month from today on the 14th of May. Keep connected, keep helping each other, learning, sharing, supporting. Keep well. Thanks very much for the time. Apologies for my audio quality, must try harder, but at least my signal stayed this week. It often drops out. Over to you, Zach. Thank you.
Thank you, Alan, and thanks for all the reminders. So remember that 1st of June 2021, put it in your diaries. I'd love to introduce you to Radhika Nair next, who's our Civility and Respect lead. So over to you, Radhika.
Radhika, you're just on mute at the moment. All right.
There's always a first time. Thank you, Zara, and it's great to be here. I will start with an update on where we are in terms of the national offers in the health and wellbeing space, and then briefly touch on the focus areas for 2021-22. So as you know, in response to the pandemic, we put together a comprehensive package of emotional, psychological, and practical health and wellbeing support for the NHS. As you can see on the slide, we continue to provide a range of offers that people can access easily and rapidly. We are still seeing a lot of interest and high uptake at wellbeing events, use of wellbeing apps, the helplines that continue to offer the much needed support, and the coaching sessions. There is specific coaching support for BAME colleagues and primary care. And just to remind you all that these services are for helping you manage your own health and well-being and also for looking after others in your team. Next slide, please. If you would like to find more information, it's available on our the NHS England website. And also you can contact the national team by email and by Twitter. Next slide, please. So it is important that the health and wellbeing offer continues to evolve this year, and our focus will be on three main areas. So these are, the first one is to focus on supporting health and wellbeing guardians. They are a non-executive director or equivalent who looks at the organization's activities from a health and wellbeing perspective. We need to ensure that wellbeing guardians are supported in their role to champion health and wellbeing consistently within these organizations. We have held webinars tailored for different audiences, such as the trust and the primary care, and are now working with the health and safety executive to produce an indicator tool that guardians can use to assess health and wellbeing performance for their organizations. The third focus area is that you may know about, the second focus area is that you may know about the health and wellbeing conversations. We need to equip line managers and teams with the tools they need to take ownership of health and well-being for themselves and their team. And that supportive, compassionate conversations take place routinely. The third focus area will be to continue to deploy mental health services that staff can access rapidly, while also promoting the current offer, which is in place, and it is being delivered through 40 mental health hubs. We need to focus on occupational health becoming an integral part of the preventative health and well-being management system. This will help organizations to develop interventions and to own it. We are working with Steve Rubin on some of the recommendations on occupational health, so please watch the space. And finally, just to say that while we need to have a focus on these three key activities in the year, we will ensure that people recovery sits at the heart of what we do. Thank you. Over to you, Zara.
Thanks, Radhika. So thank you both for those national updates, and apologies that some of the audio wasn't too good on Alan's update. We can also provide a little written update as well as maybe a re-recording as well. So we're now going to move into finding out a little bit about civility and respect and your experiences as well. We're going to use Menti today. I don't think we've used Menti on our previous sessions. So what I'll do is invite you to go onto menti.com. You can do this by on your phone. You can scan the QR code using your camera on your phone, or you can just go to menti.com on an internet browser and put in the code, which is just here. I'll ask for that to go into the chat room as well. The first question on there is, I'd love to know, have you personally experienced negative behaviour at work? The reason why I'm using Menti today is it's all anonymous. So I'm going to ask a few questions that I'd love to just get your perspectives on. So please go to menti.com, and then I can see that the number is in the chat already, and to just answer this question for us, and then I'll ask Sarah to share her screen. If for any reason you can't access it, then please don't hesitate to add to the chat box in either Zoom or YouTube. Over to you, Zara. Let's see the results. And Zara's just sharing her screen at the moment. And we've got 88 people, so thank you for joining that. And it's going up quickly. Unfortunately, a lot of people are saying that they have experienced negative behaviours at work, with people saying no. So shall we go on to our next question, Zara? So if you've personally experienced negative behaviours at work tomorrow, how confident are you about taking action? So you can pop yourselves on this scale of not very confident to very confident. So if you experience negative behaviours at work tomorrow, how confident would you feel about taking action? Sarah, has that moved on okay?
I don't think that poll slide is working, unfortunately.
Okay, not to worry. Let's see if the next one's working. This one's fine. So if you have any worries about dealing with negative behaviours, what are they? So if you have any worries about dealing with negative behaviours, please do share. What are they? We've got a few coming in now. So we've got a few people saying, could it make me look bad? Kickback. Nowhere to go, being listened to. So please do keep those coming in. And so there's looks like quite a few worries that people have got about dealing with negative behaviours. We're going to come back to these. But throughout the session today, from Radhika and our other speakers, we're going to have lots and lots of top tips, and hopefully this will give you some ideas about what you could do or how you could support others through dealing with any negative behaviours. Thanks, Sarah. So 1 second, I'm just going to share my screen.
Thank you. We're still getting lots of responses here, so please do keep them coming.
Thanks, Sarah. So, Radhika, back to you as the lead for Civility and Respect in NHS England and Improvement. Can you tell us a little bit more about the programme and what is it and the toolkits that are available?
Yeah, sure, Zoe. The first thing to say is I'm really excited that this event has a civility and respect focus, and it feels very timely too, given what we've just seen on the Menti poll results. Civility and Respect is a national program at NHS EI. We are part of the National Health and Wellbeing team in the People Directorate. So our program aims to raise awareness of the impact of bullying and harassment on the NHS workforce, to support organizations to take preventative steps to reduce bullying and harassment. We want to promote cultures of civility and respect across the NHS. And this we will do through sharing evidence-based resources and best practices in the NHS. Also aligned to the overall health and wellbeing priorities for this year, which I mentioned in my earlier presentation, we will need to make civility and respect a part of the health and wellbeing systems in organizations. We will link it to the indicator tools that's being developed by Health and Safety Executive for Wellbeing Guardians. It is clear that no one organisation is doing everything well, but there are pockets of good practice across NHS which we can harness for everyone's benefit. We will support organisations to develop measurable strategies to overcome these issues in a systematic and preventative manner. To tackle these issues is a professional and moral obligation of every person working in the NHS. Next slide, please. I think we might have missed the slide. Sorry, the one before. Right, so I'll start off by focusing on the phrase civility and respect. This is about how we treat each other at work. This program is not named reducing bullying and harassment, but civility and respect for a reason, and this change in language is purposeful. It moves away from a language that highlights behaviors that we want to discourage to using language that encourages behaviors and cultures that are positive and compassionate. It's a statement which communicates that we don't just want to meet the minimum standard of reducing bullying, to rather replace it with a culture where instances of poor behaviors are confronted early on in an informal, supportive, compassionate ways, and in ways that would restore working relationships and not break those. If done properly, this can prevent bullying to materialize and to take hold. When we talk about incivility and disrespect, the behaviors can range from overt, rude, or unkind behavior, such as the tone of voice, rolling of eyes, sharp comments even, as well as covert behaviors, such as gossiping, undermining, excluding individuals. This low-level poor behavior can often come across as confusing because the intent to cause harm is not clear, and the behaviors may be so subtle that they don't fall into a formal definition of bullying. There is research that shows that grouping a very wide range of behaviors under one umbrella term of bullying and harassment does not provide the right level of focus. Instead, focusing on the behaviors of civility and respect can be beneficial for both the employees and the employers. It enables them to recognize when it happens, understand what happened, and take early action to address the underlying behavior to prevent it again from it happening again. It helps employees to better understand and explain what they are experiencing. It enables managers to identify the issue and address it. And most importantly, I think this is for all of us as employees, when we become witnesses and bystanders, we are able to call out the unprofessional behavior. Civility Saves Lives campaign identifies that within highly pressurized NHS systems, behaviors of incivility and disrespect are commonplace, and highlights the detrimental impact this rude and unkind behavior has on patient care and staff experience. Next slide, please. So as we know, bullying remains a big problem within the NHS, which is evident from the NHS staff survey results. Both NHS long-term plan and the People Plan sets out a vision to support transformation across the whole NHS. To tackle bullying and harassment and to create a compassionate and inclusive culture remains a topmost priority. The civility and respect work we do fits into a number of different areas of the People Plan. The Looking After Our People section makes a direct reference to providing a civility and respect toolkit to all trusts by March 2021. We had this toolkit ready in December and it's been shared since then. The toolkit also uses a number of themes which link into the People Plan section on belonging in the NHS, specifically with work related to just cultures and inclusive and compassionate leadership. A point to note here is that this year's survey results show a slight improvement on previous years on the bullying and harassment theme. But we have a lot more to do to support and encourage individuals and line managers to take preventative steps to address this issue, as we've seen from some of the comments that came up through the Menti poll just before this. We also know that staff with one or more protected characteristics, such as disabled, BAME, LGBTQ+ colleagues, are twice as likely to experience bullying and harassment. The latest Workforce Race Equality Standard data shows that for 82.7% of the trust, a higher proportion of BAME staff compared to white staff experienced harassment, bullying, or abuse from colleagues in the last 12 months. The other important factor, which we don't very often talk about, and which we must consider here, is what is the financial cost of bullying and harassment to the NHS each year? Research done in 2018 by Roger Klein and Professor Duncan Lewis estimated the cost is over 2.28 billion per year. And this, you will agree, is a staggering amount. This is made up of sickness absence, the cost of covering that sickness absence, cost of presenteeism, cost of employee turnover, and let's not forget the cost of industrial relations, compensation, and litigation, which are long drawn out. Whilst there should always be a moral foundation for tackling bullying and harassment, I think there also needs to be a recognition of the real costs associated with this issue. Next slide, please. The Civility and Respect portfolio of work has grown out of feedback that NHS organisations need practical guidance on what they need to do, where to start, how to use an improvement methodology, how to use an informal restorative approach, and finally, and most importantly, how to sustain this activity. So the programme has spent time pulling together a number of resources such as the Civility and Respect Toolkit. This toolkit has a framework and an improvement approach that organizations can use to work through their own specific issues related to bullying and harassment, and can look at ways in how they can adopt a restorative approach. The program has developed a bullying cost calculator to help each trust to estimate what their annual cost of bullying will be. This will support the trust to produce local business cases to undertake detailed work around their bullying and harassment issues. Last week, we updated the cost calculator with the 2020 NHS staff survey score, so it's all good to use now. At the end of the toolkit, there is a section that provides plenty of practical resources and tools, including case studies, links to e-learning modules on Just Culture by Mercy Care, and websites which show work undertaken by other healthcare bodies. These resources are currently available to download from the Social Partnership Forum website. And we are always keen to hear from organizations in the NHS and outside about how they're tackling these issues or what work they're doing to promote civility and respect. There are organizations out there looking for inspiration and to learn, so please contact us if you think you have something valuable to share. And finally, just to mention that the national program is organizing its first event on promoting civility and respect in the NHS on 13th of May. NHS Trust is coming along to share its story on civility and respect and what impact they're making as an organization. We are also inviting colleagues from 5 other national programs under a theme, one goal, different approaches, to share how the work they do links with the Civility and Respect program, and in a much more broader sense in achieving the long-term plan and the people plan goals. These national teams are violence prevention, freedom to speak up, workforce race equality standard team, culture and leadership team, and retention. Thank you for listening, and over to you, Zoe.
Thanks, Radhika. So lots of information there about, excuse me, about the programme, toolkit, and another event. So if you would like to join that event, we'll put all the links into the into the chat box as well. So I'd now like to introduce Professor Duncan Lewis, who is Professor at Plymouth University and Director of Longbow Associates. Now, Duncan, you've been doing lots of work, haven't you, on one of these key ingredients for effective organisational solutions when tackling bullying, harassment, incivility and disrespect. So I thought we could probably start with a question to you about why is this a troubled area?
Thank you, Zoe. Thank you, colleagues, for the invitation. Why is this a troubled area? It's been a troubled area for 30 years, continues to be a troubled area, and it's not just troubling in the UK. The founding father for research in this area around workplace bullying is a clinical psychologist from Sweden called Heinz Lehmann. And Heinz Lehmann noted back in the 80s that he had an overrepresentation of people coming to his clinic from health and social care working environments. We see this pattern in Germany, we see it in North America, in Australia, New Zealand. There are lots of inappropriate behavior, shall we say, emanating from this particular industrial sector. So in the UK, you would come under the umbrella term of health and social care. And when we conducted our research a decade ago now, which was the last time a major study was conducted in Great Britain, just looking into my notes here, we found 40% of our sample reported some element of incivility and disrespect. We didn't ask about bullying because we found in our pre-trial work that lots of people get very confused about bullying. And if I think about the NHS staff survey's own question, I don't think that's a particularly helpful question. I've made this point to the ministers over the years, but I keep banging the drum because the question states, in the last 12 months, have you been bullied, harassed or abused? And then it gives 3 options. Bullying, harassment and abuse are 3 separate things. So as a respondent to a survey, you're sat there with not very long amount of time to answer the question, having to make up your mind, what is bullying? What is harassment? What is abuse? Are they the same things? Are they different things? And if they are different, how can you capture that in one question? So I think there's part of the problem, and certainly for me, where I get called into NHS organisations to help them understand why they've got a bullying, harassment or abuse problem, is trying to unpick what that means. And so the topic of our conversation today is civility and respect. In our national study a decade ago, and I'm happy to share the report with you that you can share with any colleague in this call today. It's free, easy to read. There's an NHS case study in there too. There were around 13 behaviours covering incivility and disrespect, the sorts of things Radhika referred to earlier, gossip, rumours, all sorts of issues. So when I go into an NHS organisation, part of my first task is to listen and to see what people are talking about. So typically I find that I can get a whole spectrum of things coming forward. And I think one of the best ways for colleagues to think about this issue is to think of a staircase. Think of a staircase where at the bottom of the staircase, life is grand and we don't have any problems. But sometimes we have disputes at work, we have conflict, we have, what we call incidental slipping into tension, where we get out the wrong side of bed, or the sun isn't shining, or they've got too much to do. And if that's not addressed, it builds. And so the next step on the ladder, on the steps, the stairway, we start to see tensions building and establishing themselves. Now, importantly, bullying is not at the bottom of that staircase. Bullying happens roughly beyond the midpoint. So if we think of 10 stair treads, bullying would be about 0.6 or 7, because it's repeated, inappropriate behavior that people cannot defend themselves against. And part of the challenge for all of us is recognizing what bullying is and what bullying isn't. And so acts of incivility, acts of disrespectful behavior, if left unchallenged, can build to bullying. So civility and respect is a subset of bullying. In the same way, other forms of unreasonable treatment can be a subset of bullying. It's what we do about them to prevent them becoming bullying. And at the top of the staircase, we see suicide. We see the absolute sanction where someone can no longer cope and they take their lives. And I've seen that in the NHS. I've had it at first hand. And if you allow me to share with you just one small example of a registrar in an acute trust who was struggling in his role with the demands being placed on him, and instead of being mentored and supported by the consultant, was constantly ridiculed, constantly pulled up. He recognized his own practice needed help. He recognized his own practice was not maybe what it should be, but he wasn't mentored, he wasn't supported. And by the time I contacted him, it was 3 weeks after he tried to ride his bicycle under a truck. And we do get the extreme examples where people are exposed to all sorts of things over time, which ultimately negatively impact upon them. Of course, some people never get to that, and we don't want anyone to get to that stage. So we shouldn't see civility and respect as something which is a lesser form of bullying. It's a form on the way to becoming bullying if it's not dealt with. And something I think is important to share, you asked about toolkits and solutions. Obviously, Radhika has talked about the toolkit, and I've been lucky enough to be involved in some of the elements of that. Is we looked at 8 case studies of NHS organisations who were putting resource in to try and reduce their bullying and harassment figures, to try and get a better outcome. What we found, generally speaking, was in many NHS organisations, there were 1 or 2 key individuals who were driving this agenda. If you lose those people, if they move on, the risk of this initiative collapsing is significant. So if I think who is in Mersey Care, who has done an absolutely fantastic job of driving Mersey Care's agenda, has been held up as a brilliant case study, I really worry if she's not in Mersey Care, what might happen to that intervention. And so typically, I think with interventions, what we see is a lot of effort from colleagues in the NHS. But what we don't see are KPIs, and we don't see an evaluation of those KPIs. So in one trust I looked at, they had what they called a Cup of Kindness campaign, where they had sort of 100 mugs produced with some kindness labels on, and every time you encountered a kindness experience as a colleague, you went and made a cup of tea or cup of coffee for someone in the cup of kindness, and you handed it across. Brilliant, simple, effective. Evaluated, less so. So interventions happen regularly in the NHS. There's a lot of effort going in, but we're not always measuring how effective those interventions are, what works, what doesn't work. So I think one of the important messages here in terms of a toolkit is having a sufficient cadre of colleagues who are driving this agenda. It cannot fall to 1 or 2 people. So I would see typically a non-exec director being involved, a nominee from the executive, freedom to speak up guardian, a staff side representative, a HR representative, and some representatives from across the workforce, OD and so on, typically the colleagues we've got in the call today, and having a team approach to this. And one of the key things, and it came up on Radhika's slide, was how you analyze your data. So when I looked at the 8 case studies, they were capturing data on things like turnover, for example, or they may be capturing data on discrimination cases or leavers, but they weren't doing it consistently. And it wasn't really being picked up sufficiently by the executive. So to me, the executives were lacking strategic oversight on why this is such an important issue. And certainly, as Radhika pointed out, I was involved in writing the paper with Roger Klein in 2018, where we estimated the costs of bullying and harassment to NHS England as 2.3 billion annually. And that was a very conservative figure. We could easily, that was at the lowest point, if you like. If we'd taken a midpoint, we'd have been over 3 billion. Mm-hmm. This is a significant cost. It's about time the NHS grasped this. I have been in Westminster, where the former Undersecretary for Health thumped the table and said, we've got to deal with this issue. Well, we're still dealing with this issue. And so, yes, it's a moral issue. It's an economic issue. But fundamentally, it's the right thing to do. We shouldn't go to work feeling like this. And certainly in your straw poll conducted earlier, lots of people are worried about speaking up because of the repercussions of that, because it might be career limiting and so on. So, we could talk all day about this. So I've got 35 years of experience in this field, so it's hard to do it in 10 minutes, but there's a lot of things that can be done. But the starting point, cadre of colleagues and executive buy-in, and every month there should be a standing agenda item to the executive on things like measuring the data, analysing the data, KPIs, and evaluating interventions.
That's great. Thank you ever so much, Duncan. There's loads of comments for you in the chat boxes, so please do have a little look at those. And if I could encourage you to answer some of those, and what we will be doing as well, we will be sharing all of the documents. Duncan's got lots and lots of documents, so we'll share them all with this recording on the Horizons website. Some of the key things that I just heard you talking about there, Duncan, you know, making sure that it's everybody's business, every interaction counts, that there's consistency, that there's people are taking this very seriously at all levels of an organisation. And if we don't, there's significant cost. And I was blown away by the amount of money through the cost calculator. So thank you ever so much for sharing all of that with us. And we look forward to doing some more work with you and sharing that through the Twitter and on the website as well. Thank you ever so much for your time, and please do take some time to have a little look at the comments in the chat box. I'd now like to introduce for you our next speaker, who is, well, my slides have gone a little bit funny, but they'll no doubt pop up shortly, who is Dr. Chris Turner. So Chris is a consultant in emergency medicine at the University Hospitals of Coventry and Warwick, co-founder of the Civility Saves Lives and TEDx speaker. Now, I believe you've got your slides, Chris. Yeah, they're up already. So over to you.
All right. Hi, Zoe. Can you hear me okay?
Yeah, we can. Thank you.
Excellent. I have this recurrent nightmare of standing here and talking in my living room with passion about something and then finding at the end of it that either my internet's gone down or I didn't press the right button. So it is brilliant to be here. Thank you very much. An absolute privilege to be speaking after Duncan, whose work I have admired from a distance for a long time. So thank you very, very much, Duncan. It's interesting, Duncan was talking about incivility and how it leads on to other things. I think of it as a gateway drug. When we permit that, when we permit it in our environments, people creep forward. And Jerry Hickson in Vanderbilt says that people very rarely self-correct their behavior. Of course, they don't self-correct because they don't know that they're doing it a lot of the time, despite what we think. Now, normally when I do a Civility Saves Lives talk, what I do is I'm talking to a group of people who haven't really thought about this, and my purpose is to take them from pre-contemplation into contemplation, but that's clearly not necessary here today. So I'm just going to talk a little bit about Civility Saves Lives, and then I'm going to talk a little bit about some of the evidence that's out there at the moment. So Civility Saves Lives, it's a grassroots organisation. It's people who work within the NHS. And our purpose is really just to raise awareness of the impact of negative behaviours on performance of individuals and teams. And we couldn't really have done this 20 years ago. And the reason we couldn't have done it 20 years ago is because there wasn't that much healthcare related evidence. There is now, and frankly, people in healthcare won't change if they don't think there's a good reason for changing. And I'm with Duncan, it's nice to be nice. But if you are somebody who, and I'll use a lazy trope here, okay, I'm going to use the surgeon. If you're that surgeon who only cares about getting the best outcome for her patients, then actually treating people nicely doesn't have value if treating people in a more hostile way gets better results for your patients. And one of the really good things nowadays is that we have the evidence that can show the impact of negative behaviors on outcomes for patients. So let's get going. I want to talk specifically about performance in complicated and complex environments. The evidence around negative behaviors in really simple environments, dead easy stuff, is that it doesn't seem to have a massive impact. But as soon as we're working in teams together in healthcare, as soon as we're working towards that shared goal, and we rely upon lots of people to perform at the same time, then how we treat each other becomes crucially important. And I'm going to share a really quick model. This is something I've been thinking about for a long time, and it's going to seem like such a simple idea for something that I've been thinking about for ages, so apologies for that, but I'm kind of slow about this stuff sometimes. But the way I see it is this. When we're working in complicated and complex environments, everybody has information that other people don't have. The evidence on this is that the information that we share determines how good an outcome we're going to have. And what that ends up for me is this kind of image. And I think of it as the pool of information that is out there. And each individual chooses to share that information, to turn their tap on or to not turn their tap on. Sometimes to turn their tap off once they've started. And the things that influence this are the level of psychological safety that we have within the group, because if we don't feel psychologically safe, we image manage and we shut up so that we don't look stupid, or that somebody doesn't point out that we are stupid. If we can create environments where people feel permitted to share the information, and that is primarily through our behavior towards each other, then we get the most information. And when we have more information, we have a better chance of having better end results. And that's what the risk in an areas work shows, and what a bunch of other people's research has shown us about healthcare. Okay, I want to talk just for a minute or two about recent evidence, and I'm going to scoot through this really quite quickly. First thing I want to talk about is a piece of work done by Gadi Gillam. Gadi Gillam did this piece of work where he looked at what was the impact of witnessing incivility on people when they were more or less empathic. It turns out that people's empathy is normally distributed. There are those people who don't have a lot of empathy, and there are people who really feel things, and they have lots of empathy. And what he found was that if you expose people who aren't really that empathic to incivility, not directly to them, just being around it, it doesn't really have much of an impact on them. They cope just fine. But if you go to those people who are significantly empathic, then they are much more negatively affected by witnessing incivility. And I think that is really important in our world. It's really important in our world because who do we want to be providing care? Do we want the cold fish who just does it and moves on? Or do we want somebody who cares, who clearly gives a damn? And if we want those people to function at their best within healthcare, if we want those empathic people and we want them to function at their best, then if we allow environments that frankly create a threat response in them and cause them to perform at a lower level, then we are setting ourselves up to fail. Another piece of research I want to just really quickly go through is by a guy called Dan Katz. Dan is an anesthesiologist, so he's in New York State, and he did a simulation study. And in his simulation study, they videoed anesthetists, and they showed this video to people who didn't know what had happened in the simulation. And in the simulation, the patient has a massive hemorrhage. Now, when a patient has a massive hemorrhage in an operating theatre, the surgeon tries to stop the bleeding, but the resuscitation is done by the anaesthetist in general. And what Dan did is they had a slightly rude surgeon and they had a completely polite surgeon. And what did they find? Well, they found that the percentage of anaesthetists who were performing at the expected level when they had the polite surgeon, just over 91%. But when they had the slightly rude surgeon, this wasn't screaming and shouting, there weren't scalpels flying around the room or anything like that. This was just somebody who was a bit dismissive, told them to hurry up, come on, the last guys were better than you. Their performance was just over 63%. And that's a p-value of 0.007 if you're into p-values. Now, that's interesting. And by the way, I don't think this is in any way about anaesthetists and surgeons. I think this is all of us. It's interesting, but it's not the most interesting thing about this for me. Most interesting thing about this for me is that what Dan did afterwards was he went and he spoke to the anaesthetists. And he said to them, did you have the rude surgeon or the polite surgeon? And they got it right. They knew if they had the rude surgeon or the polite surgeon. He then said to them, did it have an impact on your performance? And they said, no, of course not. I'm a professional. And what that says to me is that we recognize it, we think we are mitigating for it, but we don't. And that's another reason why this becomes really important stuff to try to stop. But there is some much more positive stuff kicking about out there. In the last couple of years, a small trickle of papers about the impact of positive behaviors have started to come out. So rather than the absence of negative, what happens if we are positive towards each other? And the first one is actually by the Riskin and Erez and Bamberger. And what they've found is that in high stress situations, if there's positive information fed to the team before the high stress situation, so before they go into simulation of a neonatal peri-arrest, if people say positive things about the performance of the teams and how much people value them, then their performance, when the simulation goes horribly wrong, and it's meant to, their performance is statistically significantly better by being primed by positivity. That's important. That's a good thing to know about, I think. The second one is by Bertrand and Evian, which is in a British Journal of Anesthesia. And in this study, before anaesthetists went into a simulation, and hey, no surprise, the simulation goes horribly wrong. If they were spoken to in a positive way by the senior person who briefed and said, I know you've got this, you'll be okay, just go and do this stuff, and they went in, then their performance was significantly higher, statistically significantly higher again. And what this is the bleeding edge of research, which is beginning to say, not only is the absence of negativity a good thing, but we can perhaps have even better results by being more positive. But it has to be appropriate, obviously. Now, a lot of this stuff feeds into bullying and harassment, but in a kind of different way. And I spend a lot of time talking with people about bullying and harassment and trying to understand it. And one of the things that has been my lived experience of this is that so much of it is misunderstandings. And I'm going to absolutely bang through this super fast. And I think that understanding misunderstandings is an important thing, because if people can get their head around this, that they get things wrong, then that opens the door to being wrong and to thinking, maybe I misinterpreted what was going on. And that can stop people wanting blood from each other, which is not a good place to be starting. So rhetorically, have your words ever been misunderstood? I'd be astonished if they hadn't. Just something to think about for a second or two. When you are speaking to somebody, or when you send them an email, what percentage of that are they going to understand? When somebody is speaking to you, or you receive an email, what percentage of that are you going to understand? And this is, to my mind, quite interesting stuff. This is Kruger and Epley looked at this early 2000s. And it turns out that we believe that other people will understand about 80% of what we send them, whether it's an email or whether it's speaking. But when we receive things, we think we're smarter than that. And we think, actually, you know what? I'm going to understand 90% of what you've just said to me, and I'll understand 90% of your email. And that's interesting as a starting place, but it gets a bit crazy just afterwards, because when you look at what they really understand, turns out that receivers understand about 78% of the voice. So the senders they're actually very accurate. And we're probably accurate because what happens is that in the real world, we get feedback in the moment and we get to understand what's going on. However, when we send an email, that can be in the mid-50s. That's if the email has nuance, it's not just some numbers. And that is scary, because we believe that we understand 90% of this email that's arrived on our doorstep. And actually, we're only getting about 56% of it. And you can see how fights start very quickly as the escalation and the flame war starts. And a question that I have is, if bullying and harassment, if a lot of this is through misunderstanding, what can we do about it? And super quickly, this becomes about speaking. But there are lots of different ways of doing it. There are organizations that have courageous conversations. There are organizations that do speaking truth to power. And then there's another intervention, which I believe is the most strongly evidence-based one, and that is a second messenger system. Second messenger systems where the person who feels hard done by or feels bullied isn't responsible for going and speaking to the other person. Second messenger systems where somebody else can go and do that with compassion. The evidence about them, and again, this is from Vanderbilt, Nashville, Jerry Hickson, the evidence about them is that they are hugely powerful in healthcare settings. Okay, so listen, thank you so much for inviting me to talk at the launch of this document. This is hugely important. It's important because it speaks to organizations, it speaks to boards, it speaks to departments, and it speaks to practices and individuals as well. But it's not enough on its own, because really we can't afford for this to be a top-down initiative. This needs to be about what we role model.
I think we've just lost Chris. Is everybody else?
Chris is just frozen for me as well, Zoe.
So
just grow and grow, and we will become aware of it. And it's a wonderful opportunity, because by choosing to behave in ways that value and respect the people around us, we help individuals to perform at their personal peak. When we have individuals and teams who perform at their collective peak, we get the best outcomes for patients, but actually equally importantly, we get the best outcomes for staff. Or in other words, civility saves lives. And thank you so much for giving me the chance to speak today.
Thank you, Chris. Such a powerful presentation and so much content in there. We've been lots of asking for your slides and whether you could add to your slides some of the references as well that we could share. And if there's any documents you think would be useful to the community, if you let me have them and Radhika, and then we will put them on the Horizons website as soon as possible. So I would love for everybody to write in the chat room, whether you're in Zoom or YouTube, what are you going to take from this session? I'm taking loads, and I love having this front row seat. One of the things that I've been thinking about is this positivity, and really being at the positivity being at the forefront of what we do and how we do it, and also speaking truth to power. I'm going to ask my colleague Paul if we can just put a poll up. So we're going to have a poll in Zoom, and if you're in YouTube, if you could pop it in to your chat room today. To what extent has the session been useful in your own role in supporting the health and well-being during and beyond COVID-19? Number 1, not helpful, all the way to number 5, which is very helpful. And please do add to the chat box, what are you going to do from the session today? And we're getting quite a few of the numbers coming in already, and I'll just leave that to run for a little bit longer. So please do add to the chat box if you can't see that. So 1 to 5, 5 being high, and to what extent has today been helpful? So I've got 2 more things just to show you before the end of our session. One is about the School for Change Agents. Zara, would you like to share this? And I'll just get onto the right slide for you. Here we are.
Yeah, sure. Sorry about that. I was just finding my unmute button. But we've got a great opportunity to share with you all, and that's the School for Change Agents, which is back on the 19th of April. So the school is about learning to become an effective change agent and put into practice the skills to help you implement what you've seen today as well. So we've got loads of amazing videos and articles to share with you. And the best thing about it is that you can do it at your own pace. The school is absolutely free to join and take part in. England, and it's already a global community of more than 20,000 people. So you can join that community on Twitter, Facebook, Instagram, and also sign up to the school, and I'll put a link in the chat box very shortly. Thank you, Zoe.
Thanks, Sarah. So please do join the school. Please do join our next session as well. So our next session is Wednesday, the 12th of May. Same time, it's the second Wednesday of every month, and we're going to be focusing on recovery of our people. So I'd like to thank all of our speakers today. It's been fantastic. We're going to be ensuring that the recording is available. All of the slides are available. They'll all be available on the Horizons website as soon as possible. So thank you to our speakers. Thank you to you for all of the work that you do across health and care. And thank you for joining.